Side by side our fears are done. All the good times just begun.
Hi everyone, my name is Jane and I've lost over 30 kgs through bariatric surgery conducted in South Africa. You guys have asked me a lot of questions on Instagram regarding the process. So today I'm finally making that video to answer some of your questions. Just as a disclaimer guys, of course, this does not constitute medical advice, nor does it constitute financial advice. No? I am merely sharing my journey and the process that I had to go through in order for me to get approved for the surgery. Okay, so I have your questions jotted down on my notebook, so if I look down, please bear with me guys. I'm just ensuring that I don't miss some of your critical questions. All right, without wasting any more time, let's get into it. So the first question that I get asked quite a lot is, where did I have the surgery done? So I had it at Netcare Waterfall City in Midrand through the Center of Excellence for Metabolic Medicine and Surgery, so CEMMS. So this center is headed by Dr. Gary Feta. He is the head surgeon. With him, he's got a multidisciplinary team of medical specialists that will be working with you once you embark on this journey. Okay, and then in terms of the procedure that I had what we call BPD-DS, so bilipancreatic diversion with duodenal switch. So this is basically a mixture of what we know as the vertical gastrectomy, which is the VSG, where they cut your stomach into a tube. Yeah, so with me they had that done. So they cut my stomach into a tube, and then they also did a bypass of my intestines. So what they do is that they take the lower end of your intestines and they connect it to the lower end of your stomach. So what that does is that it makes sure that the food only gets absorbed further down on the intestines. So that will obviously aid in ensuring that you lose the weight. Okay, but what that does as well is that it reduces the surface area for nutrient absorption as well. So we'll get into issues around nutrient absorption and the need for supplements later on. Okay, and then so in essence it's a gastric bypass, but not the Roux-en-Y, which is the traditional gastric bypass. So with the Roux-en-Y gastric bypass is that they cut your stomach into a little pouch where the food will be gathered, and then they do a bypass of the intestines. So guys, again, I'm not a medical profession. Please do your research so that you get a better understanding of what the different procedures are. So with my center, they do that the VSG, which is just cutting your stomach into your tube so that you eat less food. Then the second type of surgery that they do is the gastric bypass, the Roux-en-Y, and then what they call the SEDI. The SEDI is also a VSG with the bypassing of the intestines. So the difference between the SEDI and the BPD, I think it's how they bypass the intestines. I think with the SEDI they do a loop or something like that. But again guys, please go and do your research. And again, if you meet with your surgeon, he will take you through the different procedures, what they entail and what are the benefits, who qualifies for which procedure, and so forth. So with me, I did what they call BPD-DS. And then usually what I know is that they usually recommend it for people that have got a significant amount of weight to lose. But with my doctor, he found that the surgery has less complications than the other types of surgeries. So if you don't have that much weight to lose, then he gives you a much longer intestinal tract so that you have more surface area for the food to be absorbed. So that was my case as well. He didn't give me a shorter intestinal tract for absorption. He gave me a much longer tract. Okay, so that's that in terms of the type of surgery that I did. And then how did I get approved for the surgery? So there is two criteria that you need to meet in order to be accepted for the surgery. So, well, either or of the criteria. The first criteria is that your BMI needs to be over 35, and you need to be having two illnesses that you can prove or your doctor can motivate that will be resolved through the procedure. Alternatively, if you have a BMI of over 40, you can be accepted for the procedure. Okay, this is usually the medical aid requirement that they need you to meet in order to be approved for the surgery. What they have on the website, on the CEMMS website, is that if you don't meet this criteria, but there is enough medical motivation, and you are a cash paying patient, obviously once your doctor has done the proper due diligence, he can approve you for the surgery. But in terms of what is acceptable by the medical aid is that you need to have a BMI of over 35, have two illnesses that can be resolved through the procedure, or if you have a BMI of 40, you can automatically qualify for the procedure. So in my case, my BMI was 49, guys. Yo, I got there. Yeah. So my BMI was 49, and automatically I got I met the criteria, right? So just to give you an idea, I'm 157 centimeters tall, and at that time I weighed 122 kgs. So I'm pretty much short. So it is easier for me to get to a high BMI, mainly because of my height. Right? And then in terms of the process, so the process from your initial consultation up until the day you go for surgery. So the first consultation will be with the surgeon, so with Dr. Gary Feta in my case. So the consultation really is just to get the doctor to understand your history with weight management, and then the doctor will also take you through the different procedures that are available if he feels that you are the right candidate for the procedure. And then he will then prescribe or refer you for full blood tests, right? So you'll go for full blood tests. You'll go for a gastroscope so that he can see exactly what is happening in your tummy. And then you will be referred to a dietitian. You'll be referred to a psychologist. You'll be referred to a physician. And if you have sleep issues like your sleep apnea and so forth, he might recommend that you do a sleep study. And then you also go for x-rays and ultrasounds. Yeah. So there's a lot of tests that you guys do before you can actually have a motivation put together for you to actually be approved for the surgery by the medical aid. So I had to go through all of those tests. I had to go through all of those consultations with the psychologist and with the dietitian. And the journey with the dietitian really, guys, is to help you to unlearn some of the bad habits that you might be having with regards to your diet. Okay? And then the second part of it is to prepare you for surgery. And then the third part of it is to prepare you for post-op. Okay. So with me, the work that I did with my dietitian is that he got to understand my history with weight, and also some of the diets that I've been on, and then what diet I was currently at that particular time. So with me, I had a lot of bad habits that I needed to unlearn. Because I was so into diet culture, And yeah, it was really difficult for me to unlearn some of the things that I learned through diet culture. So the first diet that she put me on was like a normal way of eating for a human being. So eating your 3 meals a day, ensuring that your blood sugar levels are consistent throughout the day. So that is the first part of the diet that I did with her. And then after that we started preparing for surgery. So 2 weeks before the surgery, I had to go on a soft diet. So here I was eating things like your mashed potatoes, your bananas, your cottage cheese. So it was essentially that soft food diet 2 weeks before the surgery. And then a week before the surgery, I was on a full liquids diet. So full liquids diet entails you drinking things like your drinking yogurt, soft porridge, like really runny porridge. If yeah, example would be your Fisher Life. I was eating like your custards and so forth, right? So this is the full liquids diet. So this diet is aimed at just ensuring that your gut or your stomach is clean and ready for surgery. And I think also part of the diet is to shrink your liver so that it is not so enlarged when you go for the op, right? So that it's not in the way during the procedure. So that is the work that you do with the dietitian. One of the questions that I was asked is that did I have to lose weight before for me to be qualified for the surgery? No, I didn't have to lose weight, but because of the diet that I was put on, which was basically aimed at regulating my metabolism, I lost a bit of weight on that diet. I think I lost about 4 kgs on the diet. So yeah, that's the work that you do with a dietitian. And then you need to consult with a psychologist. With the psychologist, he also wants to understand what is your history with weight, and also what are those mental factors that affect your weight management. So yeah, you do those consultations. But what is very essential to the process is that he also prepares your family for the life after surgery. So I had to go in, this is what they call family check-in. I had to go in with my husband. So you can choose any person in your life that you feel that they can journey with you. So in my case, it was my husband. So I went with my husband, and the psychologist explained the process and also the possible impacts of the procedure afterwards, right? So we were both prepared for the procedure and the life that was to come post the procedure. For me, guys, honestly speaking, this, I felt like it was the most critical step of the process. Mentally, I think I needed that preparation, and also for my husband, I think he needed that preparation. So your consultations with a psychologist will come in handy. And something, guys, that I liked about my bariatric team is that all the specialists, including the psychologists, they can explain the process to the T. I kid you not when I say 99% of the things that they told me to expect post the surgery and also during my hospital stay, they unfolded as they had described them, right? So that's just how experienced and knowledgeable they are with the process. So that gave me a huge sense of comfort. All right, and then how long was my hospital stay? So my hospital stay was 4 days, which is 3 nights. So the first day, it was the surgery day, and then I got discharged on day 4. Okay. And then is it painful? Okay guys, so yeah, doing a major operation, so it is bound to be painful, guys. You can't walk in there and think it's a walk in the park, whatever. No, so it is very painful. But one thing that I can guarantee you about the hospital that I went to and about my bariatric team, they are excellent when it comes to pain management. The nurses that were taking care of me in hospital, they ensured that I stay on top of my medication. So in essence, in terms of pain, I could tolerate the pain levels, honestly speaking, and I think it's because of the pain medication that I was put on. You do also get a morphine patch on your shoulder, which also slowly releases the medication, so that throughout your stay you are okay in terms of pain. First night post-op was hell for me. So when you go into the theater, I think as part of the procedure there's a tube that they put through your nose. That was so uncomfortable for me. Besides the pain, that was just unbearable for me. But as soon as they got it out, which was like I think 8 hours after you leave the theater, yeah, it just gets better. It just gets better. So for me, the only thing really that I just found very unbearable was the tube. But in terms of the pain itself, really I could manage. I've been through 2 cesarean sections, and for me this was the least painful procedure for me. Okay, and then how long did it take for me to recover? So I would say within a week I started feeling like myself again, but I was booked off for 3 weeks, mainly because of the nature of the work that I do. So I do a lot of walking and so forth, so I didn't want to go back to work too early. But 1 to 2 weeks you should be okay. 1 to 2 weeks you should be okay. And in terms of your scars as well, they would have healed in that period. How much weight did I lose? I lost 34 kilograms. When I went for my 9 months post-op check-up with my physician, she did indicate that I should have lost a little bit more than I have lost, but it is still okay. And again, guys, you know, our bodies will react differently from person to person. Some people lose the most amount of weight within the first year of the surgery. Some lose it in their second year and so forth. Again, it's very important that you don't compare yourself with other people's journeys. Ne? So with me, apparently I'm a little bit slow, but I'm not phased by the numbers. I am more concerned about ensuring that I get the right number of I get the right amount of nutrition. And yeah, I'm just listening to my body. I feel good. I fit well into my clothes, so I'm okay with my progress. And post-op care, right? So post-op care, guys, is very important. So that's where actually the real work starts. That's where the real work starts. So you will do the procedure, guys, and your body will comply. You will lose the weight as expected, né? But you need to ensure that you get the right amount of nutrition. You need to keep up with post-op consultations with your dietitian, with your physician, with your psychologist, because the journey continues. So you don't just do the operation and walk away. You need to ensure that you continue to work with your team so that you are at optimal health. So post-op care basically entails that you continue with your consultations with your dietitian, your psychologist, with your physicians, but the frequencies won't be as frequent as pre-op. And another part of post-op care is ensuring that you have your supplements on a daily basis. So like I've said, guys, the operation has got a malabsorption element to it. Remember I said they bypass a large portion of your intestines, so it will also affect the amount of nutrients that you can absorb into the body. So what that means is that you're gonna be on supplements for life. That is the reality. So you become a bariatric patient basically. So you are going to be on supplements. Your doctor will prescribe exactly which supplements you need based on your pre-op blood test, and also generically what is required for a normal body to function. So you'll be on supplements post-op. You need to continue to exercise. If you were not exercising pre-op, you need to now start exercising, because you will lose a muscle mass, you will lose a bone density. So the operation really, guys, is just a mere tool for you to lose the weight as easy as you can, but you still need to have that lifestyle change. Without the lifestyle change, guys, you're only applying to die. You're really going to have fatal results. Okay. And one thing about the surgery, guys, is that it just gives you that root awakening if you're doing something wrong, if you're doing something that you shouldn't be doing to your body. The surgery is just that tool that will tell you instantly that something is not right. For instance, if let's say if you drink alcohol, ne? And you can drink post-op, but like 1 glass of alcohol, you get so intoxicated. I kid you not. I kid you not. If you don't have enough protein, you will lose the muscle mass, and you'll notice your muscles or your body feeling flimsy, man. Ne? If you're not taking your supplements, you will feel extremely exhausted most of the time. So you need to ensure that you comply with your post-op requirements. Ne? Okay, so let's talk numbers, ne? In terms of how much does the surgery cost, guys. We are looking at around 200k for the surgery, so it's a huge investment, guys. And one thing that I am very grateful for to God is that He provided the means for me to be able to afford the surgery. Yes, I did it through medical aid, but medical aid covers only 80% of the cost. So I'm now referring to my medical aid, which is Discovery, and they only cover 80% of the cost, and then 20% of that cost you need to pop out from your own pocket. So this is where gap cover comes in handy. So I applied for gap cover. I've always had gap cover, so I claimed from gap cover, and I was able to pay that co-payment. So the co-payment is payable to the hospital, to the surgeon, as well as to the anesthetist. Yeah, the person that injects you so that you sleep during surgery. Yeah, that person. So that amount is payable to those people cash. So you need to have cash handy, guys. Yeah, it is an expensive procedure, especially if you're doing it in South Africa. I know if you do it outside of the country, like in Turkey, for most people, it is a lot more cheaper. But I was just fortunate that my medical aid covered the procedure, and I was much more comfortable doing it here in South Africa than doing it overseas. So that's in terms of the cost. And the cost does not end there, guys. Like I've indicated, post-op, you still need to have your supplements. You still need to consult with your bariatric team. So that also is another cost. It is expensive, and but really from my experience, it is the best investment that I've ever done for myself. And I also want to mention that if you're not gonna comply with what your team recommends post-op, really you're not gonna get that return on that investment. It'll be basically you flushing your money down the drain, because if you don't comply, really you can regain the waist from what I've heard, or you could develop other illnesses that will then mean you are in hospital or you are taking other medication unnecessarily. So okay, so the risks really around the surgery, it's I think more so post-op, if you're not complying with what your team recommends. Okay, and then which medical aid did I use? I used Discovery. I think I've mentioned this. I used Discovery medical aid, and you need to be on either of the two highest plans. So that is the classic comprehensive plan or the executive plan. So I went on to the classic comprehensive plan because it was cheaper than the executive plan. So I was on that plan, and yeah, how I got approved by the medical, or the motivation, sorry, so the motivation to the medical aid, so that is handled by the center, right? So they compile all the reports from the different specialists based on the consultation that you've had with them pre-op, and then they send that consolidated report to the medical aid. Then the medical aid will revert back to you with a letter informing you that you have been approved for the surgery. And then you get your date. So I got approved I think end of Feb, and then I had my surgery in March the 18th in 2024. Okay guys, I think that brings me to the end of this video. So this video really was just to outline the process for you. If you do want me to make more videos bariatric related, please send me your questions, and then I will attempt to answer more of those questions. All right, I'm not sure if I want to be a YouTuber or but yeah, I think this platform is best for these long videos. So do subscribe, and then post your questions on the comment section below, and do hit that notification bell if you want to get early notifications in terms of more videos that I'll be doing. Thank you guys. Keep well.